Don't get on with me here now.
Okay guys, heads up.
That to be confused about the one where to measure from.
Okay.
Just to double.
Yeah. So just about your measurements, okay? So can you see my lesion is the circle right here? You measure out 2 millimeters from every side, okay? Then you can dot around your new margin. So there is your new lesion. That's what you're taking out, okay? And the whole aim behind it is when you do your ellipse, you cannot go inside that margin. Okay? Here and here, you're going to have way more than your 2 millimeters, and that's okay because that's you making your ellipse. The danger is here and here. The two areas, you have to make sure that the margin you drew, your 2 millimeters, you stay outside it and you don't go inside it, because then you only have a 1 millimeter margin or a millimeter or whatever it is that you go inside. Okay, so that's where your margin comes in. Okay, the ellipse itself is just a guide for you to be able to close the wound. Okay, with practice your ellipse becomes smaller and smaller, okay, because then you don't actually need that much to close the wound. Okay, for now we say it's a third. Okay, so you measure out your area of interest, you know, your BCC or your SCC. It's 1 centimeter here, okay? So from my margin to my margin, yeah? Mm-hmm. So my area is inside my actual margins that I've made. So it's 1 centimeter. I go 1 centimeter above and 1 centimeter below. And that's kind of like the max diameter of my ellipse. That's as far as I'm going to go with it. That make sense? Yeah. Mm-hmm. Okay. So if there's one thing you have to remember is do not go inside the margins you drew. You have to take that whole area out and have your 2 millimeters around your BCC or your SCC. Other than that, it's whatever you can preserve tissue-wise to get it closed, and closed in a nice way so the wound isn't gaping open or too thick. So that comes with a little bit of practice. So I just want to show you the fishtail, okay? So when you're making your incision from the edge of the ellipse all the way down, this is where you're supposed to stop, right? And the same thing from the other side. What happens, take this around. So what happens when you don't is you keep going and you go beyond the area, okay? Either accidentally because you're doing it too quick or you haven't paid attention or whatever it is, but I'll show you how to close that if it does happen. The reason it's called a fishtail is because it literally looks like a fishtail when you're done, right? So one edge you go down too far, and then the other side you go down too far, and it looks like a fish tail. Can you see that? Mm-hmm. Right, okay. So you removed your specimen, and then when you're closing it, you have to close your ellipse the way you normally close it, okay? The only thing at the end is that you have to put in a suture to keep this wedged area intact with the rest of your wound, okay? So you can make one of those and then we can close it together. So I'll just give you a minute to make them.
She hasn't seen us on the videos. You need to give us 2 or 3.
Okay, so I might show you again just how we close the wound itself. Do you remember deep dermal? Yeah. Okay. So your deep dermals, you always start from one side to close, and you continue on until you get to the edge of the wound. Okay. So you decide whatever side you want to start on, but it has to be consistent when you're closing. Okay. So normally, if you're not supposed to make a fishtail, but if you have accidentally made a fishtail, that's fine. I'd start away from the fishtail and I'd close towards it, because at least you know this is the area that's not really affected and it's gone to plan. So again, with our deep dermals, we start deep because deep dermal, as the name suggests, you would start as deep as possible and you come up superficially. And you have to make sure that you don't go through your epidermal layer, which is the top layer, okay? That layer you have to leave it for your single interrupted sutures later on that you're going to use. So your deep dermal has to stay within the dermal layer. You come back into the wound. This time superficial to deep. If anyone has any questions along the way, feel free to ask. Okay, but I'll just keep going with ours. So, once you've done that,
anyone who's on your WhatsApp group can see the link if you want to share it or send it out to anyone.
So once you've done your deep dermal, make sure that both edges are on the same side, and that makes it easier for you to do the wound closure. Okay? So both are on the same side. Okay, I'm going to close it along the wound. Okay, so 2 throws, then your second one is 1 throw. And remember that nice loop shape that we were talking about in order for you not to make a slip knot. So always make sure that you have that nice circle when you lay down your knots on top of each other. So it's a nice circle all the way around and push down. So you can do either 2 or 3 throws. I suggest just doing 2 because you don't want too much material in the wound when you're trying to close it. Okay. Again, you're cutting fairly close to the knot that you've made, and it's buried. As you can see, you're not really supposed to see the material at all. It's just buried deep in the wound. But with every suture that you put in, visually, your wound is coming together. Okay? So if there's a stitch that you put in and it doesn't look like it's doing anything, it's because it's not doing anything, right? Either your stitch isn't tight enough or you haven't put it into the right layer. So with every stitch you put in, the wound has progressively get closer and closer to closing. So again, both sides on the same side. About 2 throws. Making sure that every time I make a throw, okay, so we have a nice circle, right? Just like that. So I just want to show you the fishtail at the end, okay? So it depends if you've made the two sides have been incised or one. It's a slightly different closure, but you can just see yourself, the whole aim is that this tiny little flap that you've made is sutured down and stays aligned with the rest of the wound edges, okay? So with that, what you want to do is you want to be able to grab the wound flap edge, okay, and suture it in here. So first of all, you have to make sure that there isn't a lot of the other two wounds that are open. So to close a little bit more of this, using a deep dermal. So just another deep dermal. There's no real difference between this and the normal ones that you do, okay? It's just to see that the edges here have come together. So this is the only part that's left, is the fishtail. So if you were to close it, okay, without the fishtail, you've closed it normally with deep dermals, yeah, all the way to the edge. Then this is the bit of interest that we've created, and we need to include that into the wound. So all we're doing so another deep dermal, okay. Taking the flap, making sure both of my edges are on the same side, okay. Even before I close it, you can see that these two edges have come together, yeah? Okay, so then all I've left is here to put one more deep dermal before I start suturing the rest of it. Okay. When it comes to your superficial sutures, your single interrupted, you'll only have to go through the flap once, and the main reason is you can imagine the blood supply to this flap is coming from where? It's all coming from here. Okay, so it's like random distribution of blood supply. Because we've cut out two edges here and here, there's only a couple of vessels coming in through that. So the least point that's getting blood supply is this little flap that we've made. So the last thing we want to do is put loads of suture material through it, because you're kind of obstructing the tiny little vessels that are giving that bit of blood supply. And that way, you know, it'll heal pretty well and it's not going to suffer from ischemia. So the more suture material you have at the edge, the likelihood is that that bit there is going to end up being a little wound site that's not going to heal. Okay, so it's important to put a deep dermal in to stabilise the flap, and then I'll show you now single interrupted, you'll only have to put in one in that area.
So you put an intradermal in both sides of the flap, is that correct?
Yeah.
Yep.
So deep dermals both sides
Just
of the
bring them
flap.
together.
Yeah. And then your single interrupted at the top, you'll only have to put in one. Obviously, if it's this is because it's really small, but if it's a really big fishtail, like if you're doing a much larger area, then you might have to put in 2 or 3 dermals. So you can, it's the same as kind of continuing on with the wound. Similar to our primary excision that we've made.
And you
So you
always
just continue
start
on.
off at the opposite end and work your way down.
Yeah.
Yeah.
What do you mean start at the opposite end?
Basically, where you've got your fishtail, start
Yeah.
the other end.
Okay.
Don't ever start at the fishtail.
Fish it in. Oh yeah.
Are you okay? Is everybody getting that? Yeah. You look confused.
So I think at the end when you're finished, okay, you can see that our fishtail is nearly in place, that it doesn't even look like it needs to have a single interrupted over it. But I would still put a single interrupted just to make sure so that your epidermal layers are kind of aligned. Okay?
And one on each side.
Yeah.
One-
One on each side of the V.
I'll show you now. Yeah.
Yeah, underneath. In the journal.
Oh yeah, no, I'm waiting for you to do that.
Oh, yes, yeah.
Because I looked at it, it's like it's all intended on.
I'm just going to put in a couple of these so I can bring the wound edges together, and then I can show you when we get down to your fishtail what you need to do. Okay, so the single interrupted, is everybody happy with that? Just put in a couple of those and then we can bring the edges together. So I'm just going to show you your single interrupted that you're going to put in. Okay, so this is where your V is. Okay, so it's kind of like three flaps and you bring them together. That's the aim of it. So the first flap, put your suture in as normal, as if you were doing a single interrupted. Okay. This flap here, you're going to have to go through the full thickness of it from side to side. Can you see that?
Show the point of the.
Yeah. And then the third part is your third piece, okay?
So one suture to bring it all together. Yeah.
Yeah. And normally you would try to use an absorbable suture to go through it. Okay. Just because it's a lot easier for you to leave it and let it dissolve. So a vital repeat or something like that, instead of a non-absorbable, because you probably won't be removing that particular one. So once you're finished, it just looks like another single interrupted, but the edge of that, the V is inside. Okay, let's just brush together. There's a couple of ways you can close this, but the whole aim of it is that you bring the edges together, nothing's really buried underneath another side, and that you're not going to leave kind of an everted edges, or unless you want everted edges because there's an ooze inside and you're doing it for maintaining vascular competency in that area, then you can evert the edges and push the wound together. But I think this is probably the best way to close a fishtail, or just the way I do it anyway. If the wound edge here is still quite significant, you know, if your fishtail extends on, then you can just put an interrupted into the other sides as normal, right? So here's just another single interrupted. And you close it off.
You just went straight through with that. You didn't go one side and out the other. It's okay to go straight through.
Yeah,
Is it?
if you can, absolutely. It's just, again, with practice, I think if you're happy, then go for it. There's no reason to do one or the other. It's just if it's a really big wound and you want a reasonable amount of soft tissue from either side, it's quite hard to actually, with the half needle, to go through both sides. But if you can go through both sides with the same needle, do it. It's fine. That makes sense to everyone, yeah? So once everybody has tried one of those, we can move on and I can show you what a dog ear looks like and how to get rid of it if you do make one. So this is all a bit troubleshooting, so if it happened, you know what to do.
How far from the edge of each side of the wound, let's say, should you leave a suture? Sorry. How far from the edge should you leave?
I would go a little bit more than
further,
that.
yeah.
Yeah.
And
So,
that would be okay.
yeah,
I
that
would
should
do
be
that
fine.
there. I'm just
Yeah.
making the fishtail now, so I can do that.
Yeah. So I think your sutures are just a little bit too tight.
Okay.
Okay, and the reason,
Further.
yeah, the reason being is you're going to remove these sutures later on, and you just have to think, if I'm removing this now, look how hard it is to get underneath
Yeah.
it. Okay, when it scabs over and it creates it, it's going to be so hard.